Let us review our body system. The integumentary system, the first system. It includes the skin and its appendages like the hair, the nail, and the glands, the sweat gland. It includes the skin and its appendage. These are the integumentary system. And when we see the function of the integumentary system, the first thing, it covers our body. This skin, it covers our body. And it is a site where vitamin D is synthesized. That's why children's, they are exposed for sunlight in order to synthesize what? Vitamin D. The other is, it is extensive sensory organ, like it consists pressure, pain receptor, pressure receptor. It is a feeling organ. We feel pain, pressure, and different kind of stimulus. The second system is the skeletal system, and it mainly consists of the bones and the cartilage. The bones are their hard connective tissue, whereas the cartilage, they are also hard connective tissue, but they are relatively resilient when we compare to the bones. When we see their function, they protect us, the organs which is found within our body. For example, the brain, which is found in the cranial cavity which is found within the skull, it is protected by the skull bone. Like the lungs, which is found here, the lungs, they are protected by the ribs, this bone. The spinal cord, it is protected. The other is supportive function. For example, a muscle, like the muscle which is found in the thigh region, they are attached with this bone. It supports different muscles in our body. They are the muscles, the skeletal muscle, they are associated with bones. Supports the muscle, which is found within our body. And it's also for the framework of our body. In flat bones, blood cells are formed. Within the flat bones, the blood cells are formed, and it is a site where minerals are stored. This is the function of skeletal system. These are the functions of the skeletal system. Another system, the muscular system, consists of the muscles, the three types of muscles: the skeletal, the smooth, and the cardiac muscle, which is found on associated with bone. They are found in the tubular structure in our body, and cardiac muscle is found on the wall of the heart. The function, the skeletal muscle especially, they are important for movement or locomotion. The muscle which is found in the face, they are called facial expression, muscles of facial expression. They do have different kind of muscle within our face, like orbicularis ocularis, orbicularis oris. They do have important in facial expression. The other thing, they maintain posture, our body positions. They produce it as byproduct for transportation, like the blood vessels. Transportation, like the heart, it pumps blood. This is the muscular system. The articulatory system, joints, which is found within our body. It's mainly concerned about the joints and the junction between what? Two bones. This is one bone, this is another bone. The junction or the union between bones is called what? The joint. The joint. And the structure that strengthens the joint is called what? The ligament. The ligaments. Therefore, a system which is concerned about the joint and the ligament, that is the articulatory system. It connects the bones, and it is provide or its function in movement. The other is the nervous system, which is the brain and the spinal cord. They are called the CNS, the brain and the spinal cord. The PNFs, they are the peripheral nerves. Away from the brain and the spinal cord, these are the peripheral nerves. The peripheral nerves are located at the periphery. They control all other systems. The 11th system, which is found within our body, controlled by the nervous system. The endocrine system, they produce hormone. They regulate growth, reproduction, and nutrient use. For example, the thyroid, it produces a hormone, thyroid hormone. It is important for metabolic activity. Like the testes, they produce what we call testosterone. That testosterone is determined secondary sexual characteristics of the males, whereas the ovaries, it's determined, it produces progesterone and estrogen. That hormone have an effect on female reproductive system. These are all the glands, the endocrine gland they are under the endocrine system. The circulatory system, it consists of the heart, which has got 4 chambers, and the vessels, in the lymphatic system. Cardiovascular system, the heart, and the vessels. The heart, it pumps blood. The vessels, their function, they transport oxygen and carbon dioxide, and also they transport important nutrients and wastes. And in the blood vessels, we found important the red blood cells, which carries oxygen and carbon dioxide, and nutrients. We found also nutrients within the circulatory system. The lymphatic system, they return excess blood. That is the lymphatic system. The respiratory system, it consists of the upper respiratory tract, like the nose, the pharynx, the larynx, and so on. They are included in the respiratory system, and the lungs. The digestive system, their common functions, digestion or breakdown of food, and absorption, the nutrients. The urinary system, it includes the kidney, the ureter, the bladder, and the urethra. They are included in the urinary system. In the function of the urinary system, it eliminates the nitrogenous wastes which is found within our body. It consists of a special structure, what we call the nephron. The nephron, they are structural and functional. unit of kidney, and they do have a special structure to filter wastes. In addition to that, it regulates the acid and the base balance. The other is the reproductive system of male and female. These are important in producing offspring, the male and the female. The male testis is the gonad, in female the ovaries is the gonad. They produce a sperm cell and the egg cell. Sperm cell and the egg cell. In addition to that, they also produce testosterone hormone and estrogen and progesterone. Testosterone in males. In addition to that, there is a gland what we call the mammary gland. In females, they produce milk. Okay, let us proceed the last section of today. The axial, which is located at the axis of our body, and the appendicular, away from the axis. Structure which is at the center of our body, it is called the axial. Like the head and the neck region. This is the trunk. This is the trunk, which includes the thorax and the abdomen and the pelvis. Thorax, abdomen, and the pelvis. The appendicular, it consists of the limbs, the upper and the lower limb. These are the limbs. Therefore, a structure which is located at the center, we call it the axial, which is demonstrated in the red. In the appendicular, with the yellow color, they are located at the periphery, of our bodies. This is one term, regional term. The other is cavity. Cavity means it is the hollow space. A hollow space. If this is a box, if this is the wall of the box, this hollow space, all hollow space or empty space, they are called what? Cavity. Within our body, there are cavities, hollow spaces, like the skull. There is a cavity which holds the brain. If this is the brain, the yellow color is the brain and spinal cord extended. This hollow space is called the cranial cavity, the empty space, the hollow space, which holds the brain. There are basically two cavities within our body, the dorsal and the ventral cavity. Let us see the dorsal cavity. These are the dorsal cavity. They are located towards the back or towards what we call posterior. For example, this is the cavity which holds the brain, that is the cranial cavity. This is the cavity which holds the spinal cord, that is spinal cavity. The cranial cavity and the spinal cavity, they are located towards the back, therefore they are known as dorsal cavity. Whereas the cavity which is found in the chest region, that is the thoracic cavity, the abdominal, and this one is pelvic cavity. They are located relatively towards the front. Therefore, the thoracic cavity, the abdominal cavity, and the pelvic cavity, since they are located towards the front, they are called ventral cavity. They are called what? Ventral cavity. Dorsal towards the back, here cavity which is located towards the back, that is dorsal. Cavity which is located towards the front, that is ventral cavity. Ventral cavity. Within our body, there are two membranes. You can take as an example this balloon. If you push with your hands the balloon, there is a cover which encircles our hand. There is a cover which encircles our hand. And there is a cover which encircles the environment. If this is the balloon, there is a cover which encircles our hand, that is the viscera. Visceral membrane. The one which encircles the wall is known as parietal. The one which encircles the actual structure, we call it this is the viscera, and the one which encircles the surrounding towards the outside, that is the parietal. This is the parietal. This one is the visceral membrane. There are two types of membrane: visceral membrane and the parietal membrane. The visceral membrane that encircles the organs. Viscera means organs. The parietal, it's cover the wall. The other thing is the region which is found within our body. For example, abdominal region structure, they can be studied using quadrants. When we see there is a perpendicular line that passes through the nipple, in order to locate the structure which is found within our body, we use quadrants. Like the liver, it is located in the right upper quadrant. The appendix, it is located in the right lower quadrant, and so on. We can locate different structure which is found in the abdominal region by using the quadrant. The other thing that we are going to discuss is the anatomical position. It is a standard reference point. It is a landmark or standard reference point to describe positions, movement, and planes. It's a standard, or it is a reference point to describe different positions, like to describe the liver, to describe the heart, to describe different organs within our body. Our body position has to be in a standard reference point. That standard reference point is the anatomical positions. In the anatomical position, the person is erect. He stand, and the palms. These are the palms and the face. This is the palms and the face that we do have, and this the face and the palms. They are forward. Our feet is what? Together. Our feet is what? Together. The eyes, our eyes looking what? Forward. And we do have a neutral facial expression. We do have this neutral facial expression. This is the standard anatomical positions. Our face is looking forward. The face is looking forward. This is the face looking forward. The palms are also looking forward. And the feet, these are the feet. They are together. And we do have what? Neutral facial expression. This is the anatomical position. Okay, there are another terms, a structure which refers to closer to the head. We call it superior. Structure which is closer to the feet, we call it inferior. For example, let us take, this is our head, this is our neck. The head is superior than the neck. Head is located superior to the neck in order to describe. For example, this is the thoracic region, this is the abdominal region. The abdomen is located where? Superior to, the thorax is located superior to the abdomen. Inferior structure which are closer to the feet. For example, the neck is located inferior to the head. The thorax, the abdomen, it is located inferior to the abdomen. These are the terms, positional terms. Another term, anterior, it's structure which is found to the front. Structure which is found to the back, it is called posterior, which is back. This is front. Other is lateral and medial. Lateral and medial. Structure away from the axis, that is lateral. Structure closer to the axis, that is what? The medial. The other terms are positional. This is the root of our hand, and this is the root for our feet. A structure which is away from the root, it is called distal. Structure which is closer to the root, it is called proximal. For example, this is the humerus bone, this is the radius bone. The humerus, is it proximal or distal? It is proximal, which is closer to the root. The humerus, it is proximal. The radius, it is distal structure relative to the humerus. It is distally located away from the root. The other thing is superficial and deep. The most superficial structure is the skin, which is closer to the environment. Deep, which is closer to the core or to the center. Deep, superficial. This is what we have seen. The dorsal cavity, the cranial cavity, and the spinal cavity. The ventral cavity is this cavity. The thoracic, the abdominal, and the pelvic cavity. The others are the positions. If the face is laid down, we call that position is poor. The other is the supine position. If our face is upward, if our face is downward, we call that position forward position. If the face is upward, that is supine position. Unilateral, in the one side of our body when we stand. Bilateral, two sides is visible. The anatomical plane, which sectors or which divide our body, there are different types of planes, like the sagittal plane. This is the sagittal plane, the one which is this plane. The green one, that is the sagittal plane, that divide our body into right and left equally into the right and the left. This plane is the sagittal plane. The other is the frontal plane. This is the frontal plane. And it bisects or it divides our body into equal anterior and posterior part, or front and back part. That is the frontal plane. The other is the horizontal plane, which divide our body into superior and inferior parts. Okay, the last one is description or describing movement within our body, like angular movement, rotatory movement, and so on. Let us see one by one. Flexion, when we decrease the angle between two bones, if this is one bone, this is another bone, this is the angle. If we decrease the angle between two bones, we call it, that movement is flexion. Extension, this is the angle. If we increase the angle, we call that movement is extension. The last one is the hyperextension. Hyperextension, excessive extension in the neck region. If we move our neck towards the back, that movement is hyperextension. The other is adduction and abduction. You see that this side adding towards the center. That movement is adduction. Abduction means away from the center. Abduction. There is also special movement in the hand region, what we call pronation and supination. If we elevate our palm side, that we call it the supination movement. If we move our hand towards the surface, we call that motion is the supination. The other is movement which is found in this joint, what we call the mandibular joint. There is a movement what we call retraction towards the back, protraction towards the front, elevation, rise, depression to depress. There is a retraction towards the back, protraction towards the front, elevation, and this movement is called depression. And there are another movement, circular movement at the axis. There is an axis. On the axis, if there is movement, you call that movement is called rotatory movement, rotation. And another movement, circumduction. Lateral flexion, bending towards the lateral side. The other special movement in the foot region is inversion and eversion, dorsiflexion and plantar flexion. This is the dorsal surface of our body. If we move towards the dorsal surface, we call it that flexion is dorsiflexion. This is the palmar side or the plantar side of our body. Therefore, if we flex towards the plantar side, we call that flexion is plantar flexion. There is also moving towards the middle, inversion, and away from the middle, eversion. These are the special movement which is found in our foot. There is also special movement in the wrist joint. This joint is the wrist joint. This side is the lateral side. This side is the medial side. There is a bone what we call in the lateral side radius, and there is a bone what we call in the middle side, that is ulna. Moving towards the radius, that is radial deviation. Moving towards ulna, that is ulnar deviation. There is also special movement on the toe, that is position and the opposition. This movement is position and opposition. It is a special movement which is found only in the thumb. Okay, thank you. It's all about introduction to systemic anatomy. Next, we will continue another chapter. See you. Thank you.